circumstance. There we go. And so when you look at the impacts of COVID, of school shutting down, of launching into telehealth services, of having family members pass away, like lots of things are changing for our kids and our communities. So Kids Mental Health Pierce County was a group that came together in response to the fact that we, even before COVID, even before we had this emergency proclamation that's on the screen here, that we were seeing increases in emergency departments here at Mary Bridge Children's Hospital, which houses Kids Mental Health Pierce County, that we were having more and more youth show up in emergency departments having behavioral health crises. And we knew that was coming in many different forms, and that there was no single system that was going to be able to take full responsibility and support these youth and their family through that. That's not going to be the hospital system. It's not going to be juvenile justice. It's not going to be community behavioral health. It's not going to be child protection services. So really what we got to do is we have to have a multifactored approach to be able to address the multifactored complexities. And so in particular, for those kids that are at the most extreme spectrum, like those that are showing up in the emergency departments or seeking long-term inpatient programs, but the entire care continuum before that, for intensive outpatient, for inpatient programs, whatever that looks like, and everything in between. So if I can have the next slide, please. We really love this slide here in our presentations because experiencing a behavioral health need for supports and services, it's not ever anything that's done in isolation. So you've got everything that happens within that youth, that young person themselves, what their family supports are, what their family crises might be, what's going on in their community. There's some environmental aspects, and then of course the societal pieces at large. And so when you talk about, again, it's not going to be one system that's going to be able to have the solutions or find the means to support these kids and their families. You also have to look at all the impeding factors that are influencing those things as well. So if I can have the next slide, please. So when you're looking at that bottom up and that up down approach, what's really come out of this has been our Youth Regional Behavioral Health Navigator program. So what that is there was a model that we found to be very successful in Pierce County, which we call Kids Mental Health Pierce County, that is rolling out across the state into what we are dubbing as the Youth Regional Behavioral Health Navigator program. And what that is it is a systemic and intentional partnership to leverage resources across the state, but also give it a very strong community feel where the kids and the families are residing so that they can access the resources at the right time at the closest place to home as possible. So this partnership is really a combination of the Healthcare Authority, Kids Mental Health Pierce County, and the Developmental Disabilities Administration. We're taking the components of this model, which I'll be speaking to in just a little bit, and we're going to be rolling it out across the 10 behavioral health admin service organizations across the state. And so that's going to be done in a wave of 3 per year. So we started our very first 3 regions in last July. So that would have been July of 2022. It was so successful that rather than launching 3 more this year, we're actually in 4 more this year. And our last 2 regions are going to be coming online next July. So that's going to be July of 2024. And so really what each of these teams are going to do with the support of Kids Mental Health Pierce County is technical assistance, is they're going to be hiring teams that serve each of their regions. They're going to be having a regionalized resource hub, which we'll have a link to in just a little bit. They're also going to be hosting really community collaborative partnerships, whether it's a multidisciplinary team or if it's going to be our steering and action committees, but bringing all those different system partners together. And I did see really briefly that we've got from Lori a question about what the ASOs are. So the Behavioral Health Admin Service Organizations. I like to put it very simplistically. If somebody else has another definition that works, please jump in. But I think of it as the organizations across the state that are contracted to provide access to services for kids and families needing, in this context, behavioral health supports and resources. So Washington State is divvied up into 10 of those regions. And so there's going to be navigator teams that are supporting each one of those regions. So if I can get the next slide, please. What's really key is that, again, we've got these statewide partnerships, but it's also going to have a local community feel with those different regional teams. But through all of them, we're really looking at some strong cross-system collaboration. So what's been so key for us that we saw in Pierce County, but now we're already starting to see the data and have the experiences for the other regions that are coming online, is you've got to work with all of these partners. So in every community, no matter where a child is, no matter what kind of insurance they have, no matter what kind of behavioral health need that they have, there's intentional collaboration happening between all of these partners. And so you see some of on the screen that I already talked about, like child welfare. We've also got partners like the schools are super critical. We've got autism disability partners. We've got community mental health crisis services. We've got some primary care, law enforcement, juvenile justice, because so often kids and families are retelling their stories, which we know is traumatizing, right? For a need that they have to provider after provider after provider. So by all of us working together, not only is it coordinating and streamlining these effects, it's also making room to not re-traumatize children and their families by having to tell their story when they're just trying to get some supports. So if I can have the next slide, please. One of those things that's going to come out of this cross-system collaboration that's happening is what we call multidisciplinary teams. And so our very own Vanessa that's on this call, she runs them for one of the regions that is Pierce County. And this is where we bring all of the partners together around a table, including the ones you see on the screen. So at every single one of these MDTs, we've got the family and or the youth that are there. We've also got the payer there so they can tap into the resources their insurances provide. We've got partners like Juvenile Justice, Department of Children, Youth and Families, especially if those kids are system involved. And then we've also got providers that are from the behavioral health field. We've got specialists, and it's really catered and customized to whatever this youth and their family needs. These meetings are really powerful because they're very strength-based. We work with the family ahead of time so that we can get some really key details about what the family is seeking, what they've tried, what they've not wanted. And then we can coordinate through that a really supportive space where we can come up with some ideas and some recommendations that maybe the family hasn't tapped into or maybe is new, because as we all know, it's continually evolving. And to Vanessa's piece in the chat, it's just the collaborative work is really a favored part because it's being a strength-based and family-focused area where families can get connected towards those resources wherever they are in accessing that continuum of care based on the severity and what's accessible in their region. So next slide, please. And when we've got all these amazing partners and we've got all these great resources, we want to make sure that there's like a one-stop shop, if you will, for families to tap into. So this QR code here goes to what we call our Kids Mental Health Washington website. So every single one of these regions that is rolling out this program has a website where they are condensing all of their local behavioral health resources in one spot. So no matter what a family is looking for, it's really in an area where you've got one QR code or you've got one link, and it's going to take you towards all the different types of information. Your crisis services are on there. You've got your different parent supports. You've got peer supports. You've got access on how to find a provider that matches what not only that you're trying to get support for, but also somebody that you identify with and you feel comfortable, because that's such a big piece of being able to get the services you need. And so we've also got information for, what does a diagnosis look like? What is a child long-term inpatient program? Just all of the dialogue and the lingo that even I as a provider can sometimes get overwhelmed with. So that's something that families can tap into also. So this covers for the Kids Mental Health Washington, the entire state, but it also has links to each one of the region's websites. So there's a no wrong door approach here. So if I can go to that next slide. One of the things that we really wanted to highlight was our partnership with the Developmental Disabilities Administration. So often, many of the families that come to our regional teams that are looking for behavioral health navigation support, or they're looking to have a multidisciplinary team staff so they can talk about their family and what recommendations they need in a space where we've got lots of different partners. So a lot of times these kids are actually needing behavioral health with resources that maybe developmental disability administrations can tap into. And those are some of the things that are on the screen here. So to be able to support that cross-system partner approach, what's really exciting is through this program, we actually have a couple of positions that we get to work alongside in helping this be a streamlined approach for families to tap into those resources along with the rest of the care continuum. So we've got a unit manager, we've got a program manager, and then we're going to have a developmental disabilities administration navigator, excuse me, lots of big terms, that will be able to be specified for each region along the state. So there's going to be a singular contact that all the partners are working with. So no matter what system and where this kid lives, there's going to be the same team that's able to communicate, make referrals, and make sure that there's that support tailored to each family in whatever stage of accessing supports and resources they're at. So if I can get that next slide, please. This is kind of where we're at. So for our first year, like I talked about, this is a tiered rollout. The first region that we had was Kids Mental Health Pierce County, and we've taken some of those components of the model and we've rolled that out with these teams that exist across the state. So our first 3 regions was our friends in Salish. So that's over in like the Kitsap County region. I love this teamwork I'm getting with the mouse pointing, so thank you. We have down south, which is our friends in Southwest, which is like the Clark, Klickitat, Skamania. And then we've also got our friends in Greater Columbia, which is like the entire southeast part of the state. And they've got 9 counties in their region. So some of the lessons that we've gotten to learn already is each of these regions is very different. Each community has different needs. And so like what could we in Pierce learn from our friends in Southwest that have really gotten some great experience of how do you serve an urban community versus a rural community? Or our friends in Salish have a lot of really deep ties to the Native American and First Nations peoples in their area. So what does it look like for providing services in a culturally relevant manner? Or of course, like I said, for Greater Columbia, when you've got that many counties in your region, how do you provide behavioral health services, support and coordination across a geographical area that big? So these are things that we are learning together. We just launched in July of this year 4 more regions, like I spoke to. We've got our friends in North Central. We've got the Spokane region, Great Rivers, and Thurston Mason. Thurston Mason is kind of like a bonus region. They were supposed to go live next year, but we actually, through some funding and just through their willingness to jump right in, actually got them stood up this year. So they're in the process of getting that regional resource up, hiring their behavioral health navigators that can help families coordinate and access this system, hosting those MDTs, and doing that cross-community collaborative partnership. And then next July, we're going to have those last 2 regions. We've got that orange, that's that North Sound, and then we've got the other part of orange that is King. So that is where it is at right now. If I can get my next slide. I really wanted to be intentional about leaving some time for questions. This is all the contact information. You could either scan this QR code and you can get on our website. You can learn a little bit more, figure out who your local contacts are, because I know this space is awesome about having statewide representation. Or my contact information, Gina Capadu, is right there. Please shoot me an email, get on our website, and I would love to collaborate with some of the great initiatives that you're doing. The piece that I'll close out with is that we just started in July collecting metrics. Every single one of the regions are going to be tracking quantitative and qualitative data about who it is that they're serving, what the barriers are, and it's all in real time. And I'm really excited about the opportunity of how being able to track where the gaps are, what some of the barriers are, and what some of the wins are, quite frankly, and being able to utilize that for policy and funding recommendations down the line. So I'll pause right there, Vanessa. I know that you're on too. So if you want to join in at all, please feel free to do so. In the meantime, I'd love to know what kind of questions you will have about this program. Maybe if we could stop sharing so I can get a bigger grasp of the group. Oh, I just saw Lori's hand. I'm glad I said that. Laura?
Yeah, thank you. Thanks so much for the presentation. I always learn something. And you probably said this, but can you say again how a parent or young person would connect with the MDC or MDT?
Yeah, that's a really great question. So they can go on the website or they can reach out to the team directly. But if they go on that website, every region has a link for how to request a multidisciplinary team meeting. And a youth can request those, a parent can request those, a school provider, an emergency department, whoever it is that's looking to wrap supports around a youth is absolutely able to access that. Once we get some basic information like their age, what's their zip code, what kind of resources do they have now? Are there any behavioral health diagnoses that we should be aware of? Any medication? We do follow up with the family and or the provider or the referent just to figure out what can we be as prepared as possible with when we bring this group of localized and catered providers together to make some recommendations on additional supports. So again, the families aren't having to retell their story to a whole nother group of people, but that we're doing that work up front in a really trauma-informed and sensitive manner so that we're utilizing the family's time well. But then at the end of that meeting, after we hear all the great recommendations and we see the referrals happening between the partners, we do send out the meeting minutes so that the families have all in one spot who the name of the provider is that's going to be following up and for what, because we know our families have so much going on and it's something that we want to take ownership of as a mean of also supporting the families.
Right. So how would somebody find out about any of it to begin with, like the website and the number to call directly, not through the website?
Well, I'll say each one of our regions. So there's 3 team members in each region. So you've got 2 people that are like program coordinators, kind of like Vanessa and myself. And then you've got like a clinical manager. They're super embedded in the community. They're going to school functions, they're going to community events. And so they're doing lots of tabling, lots of presentations. There's also been a lot of opportunity to do training. Like I know for here in Pierce County, we've got to do training with law enforcement about like what it could look like for a youth getting access to services. So that's something. And then a lot of times it's through our community providers. Like what's so key about those multidisciplinary teams and those cross-system collaborative partnerships is sometimes partners will refer to an MDT because they as a provider feel stuck. They feel like they've kind of exhausted all of their resources and their normal relationships. And that's why we want to come to the table and see what else we've got up our sleeve or try some alternative methods that might end up in a better fit for a family.
Great, thank you.
Yeah, great questions. Other questions from this group here?
Could you provide the slide to us via email or drop it in the chat?
Absolutely. I know I got the opportunity with how prepared this group is to send the slides ahead of time. I think it was to you, Erin. If you want to share those out, by all means, please do. If it's something that I could do for this group, I'm happy to take ownership also.
Yeah, no problem. I'm happy to send it out.
Yeah. And then I think I saw Lori's hand again.
Yep, sorry.
No.
Always have questions. In the areas that you're kind of working in now, are there particular kinds of providers you want to have come to the table, or how's that outreach going, and how would a provider of this service versus that service think of them as being part of this?
Yeah, that's a really great question. So there are a couple of particular providers we want to have at the table, and a lot of it has to do with we know that these youth are interacting with these systems. It can be child welfare is a really big one. So Department of Children, Youth and Families, juvenile justice is another one. We absolutely get a ton of referrals and leverage a lot of partnership through schools. And then if there is any community-based behavioral health, MCOs are a really big part, those and managed care organizations. And then what's also been really central is having family voice at the table, partners like a Common Voice Cope project or Dad's Move, so that we've got that peer aspect as well. And I think if partners want to get involved, a lot of times partners are coming to us. They show up at these multidisciplinary team meetings, or we get a chance to meet with them one-on-one. And what we realize is that these are everybody's kids. So it's not just a this partner partner or that partner, but that if I can show up in a space where I can provide recommendations to help a family, at some point, maybe I'm going to have a youth that I need to refer to a multidisciplinary team meeting. And that's an opportunity for me to see how those spaces work, be able to prep the families ahead of time, and then just know that it's a resource that's all of our communities. This is not just a Mary Bridge or a Kids Mental Health Pierce County or a Behavioral Health Admin Service Organization service. This is a community collaborative movement.
I'm curious as sort of a behind the scenes person in this group, but I'm curious too, how this effort could connect with something like the rapid response team that's launching. Isaac, I don't know if you have any off the cuff thoughts or if there have been discussions since this also has connections to the HCA, it sounds like. Will you all be referring back and forth, or is there a different kind of relationship that could emerge?
Yeah, I'm going to stabilize connection. So just a second.
I don't know if you're hoping I could hop in here, Aaron, or waiting for Gina to get back, but yeah, I can see a lot of potential for that, especially in a case where we do get a young person who is exiting from inpatient treatment. I think that could be really relevant, especially, thinking about our team, how we're more focused on the housing piece. But, if we're kind of wrapping around and bringing these MDTs in for more of the behavioral health piece out in the community, when they were, make that return to community, right? In Jim's words, I think that could be really, really beneficial. And I don't know if there's a way we're still figuring out a lot of confidentiality issues with that meeting specifically. So I don't know what that would look like in terms of maybe bringing some of those team members in, but it could, at minimum, it could just be like a referral out to the community of, hey, we know that there's these teams operating in these communities, and this can be like a resource for them when they do finally discharge and have that plan. And so it could be a part of their plan, right? We could bring it up in that meeting, talk to them about it, and see if that would be of interest to them.
Yeah, so I think my internet connection is stabilized because I switched over to data. I think, Isaac, to your points, I think that's 100% spot on. We want to have a strong referral partnership at a statewide level for Kids Mental Health Washington, but also at those local levels for each of those regions. The thing about this program is we know that there's already great work going on. We want to partner with it, build that community knowledge of resources like through that hub, and get those partners at a table. So if we're going to have a multidisciplinary team meeting or a steering committee meeting, absolutely we want to have those partners at the table because we want to champion the work that you're doing and get those families connected so there is a no wrong door approach. And I think that's the components here is you need to have that cross-system collaboration to really be able to give families the resources and supports that they want in the form that they want them.
Love that. Hey, Gina, maybe we can connect offline then about maybe how that would look. I'll put my email in the chat.
Yeah, I'll follow up with you today. That'd be great.
Awesome. Thank you.
Well, I was also wondering about the 1580 group. 1580 was a bill that passed this last session, and it put together the rapid care team, which is kind of a response to young people staying in hospitals, basically. So how do you envision that collaboration?
Yeah, I think a big piece is it's still evolving because as you spoke to, this just passed. So as it gets stood up, it's something that we want to do in partnership. So I think a lot of communication about what's the role and intention of that, what's the role and intention of this program. I think they're both really key pieces just so that we've got that supportive environment across the state and that we're honoring what each program can do better and making sure that we're cross-sharing that information. Another thing that I'll do is just kind of like a subtle plug is on September 20th. So coming up here soon at 11 a.m., we're going to be having a webinar where we're going to be talking about, and I'll make sure I include it for this group as well. We're going to be talking about what are some of those early wins that we've had for these first 4 regions that have stood up this model. What's it going to look like for lessons learned for those next 4 regions that are standing up as of July of this year? And what's it look like as these new systems come online? I know a big piece that's also been talked about is like, how have we integrated with like 988, or what's this look like as a difference from like the CLIP program? So those are some things that you might get a sneak preview of us talking about at the September webinar as well. Great questions. I'm going to check on the chat here. Isaac, thank you for that. I'm definitely going to be reaching out to you very soon.
Gina, will you tell me once more when your webinar date is, please?
Yes, it's going to be September 20th, 11 a.m. to noon.
Got
And
it.
I'll make sure, Erin, that I send out the registration information so that you can post that along with the slides.
Will do. Thanks.
Yeah, and what I'm also excited about is that it's not going to just be me that's going to be talking in that webinar. You're actually going to get to hear from and meet the different contacts for each of these regions that are standing up across the state. I, at the very least, am very much a relational person, so I like to see the faces behind the email names that come with it. Right, I'm just swiping the chat. So wonderful. Okay. Well, if there's any more questions, I'm going to be around. I'm going to drop my email again in the chat just so it's handy. I'm going to connect with Isaac and just thank you all for the work that you do and for having us. I know Vanessa and I look forward to this meeting every single month, so it's an absolute joy to be able to share and connect with you all here.
Thank you so much for presenting. And I know we have a relatively small group today, so I did record just so that we've got all of what you shared available to send out to the broader group. And thanks again.
Wonderful. Thank you.
Yeah, thank you so much for presenting for us. It's really nice to hear about different programs in our area that are trying to make things better for kids' mental health. And then up next, I'll be giving an agency spotlight on North Star Advocates. So North Star Advocates is the program that is currently, well, working on organizing the Bridge program and getting it to be its own standalone program. Most recently, from what I can talk about, I should say Jim was going to be the person that was presenting on this, and he would be a lot better at it since he's, you know, the founder. But I'll do my best. So from the updates that I'm aware of with my role in North Star Advocates, the contract for the work to be done in the Bridge program has been extended, and we're looking into different things like how to interact with more youth to get them involved in this program, how to set up meetings with Mockingbird Society in order to gauge interest in, how do I put this? See if there's youth in Mockingbird with lived experience and inpatient who would also be interested in joining and being a part of this effort. And we are planning on meeting with managed care organizations in September in order to gain more of a connection with inpatient providers. Along with the Bridge program, North Star Advocates has appropriated funds for the Pacific Tower Work Group. The goal of that being to address current systemic gaps and prevent and end homelessness for youth and young adults in the Seattle area. North Star Advocates is also involved in the Lifeline Pilot Project work group, which is supposed to function as a point of support and connections to services for youth that qualify, who require assistance to overcome life challenges and need general mentorship and counsel. Like I said, I'm not the person that knows the most about North Star Advocates, but if there is any questions that I can answer based on my experience with the organizations, I'd be happy to. Perfect. And then next up, Erin, did you want to start us off with the closing bowl?
Yeah, I think so. I think we've made it through our agenda fairly quickly today. Like Rosemary said, I think we will just ask Jim to follow up and either email you all or in the next meeting cover any additional information he wanted to share about what North Star is working on these days. But for now, for folks who've attended before, hopefully this is routine. Just take a minute to respond to a brief poll and certify if you believe you are eligible for a stipend for this time, which means you have lived experience of the issues this group works on and your time is not being paid by another entity. Let us know so that we can make sure to pay you for this time. Let me just find the right poll here. I think this has the wrong date on it, but it will still work. Please just let me know and I will make sure you get your stipend payment. And yeah, thanks again to everyone who was able to join today. I know lots of folks are enjoying the end of the summer. So I think if you're able to join again in September, we'll be back full force and have lots more updates to share. If you know of anyone else that we should invite to join this group, please send an email to Jim. I think everybody probably knows how to reach him, but I'll drop his email and my own in the chat so that you can reach out. And thank you again to Gina for an excellent presentation and to everyone who was able to join. Looks like I got responses on the poll. Back to you,
And
Rosemary, to close
Gerald,
us out.
Gerald,
Yeah. Hi. I just wanted to say one thing since I'm here in this group. Another hat that I wear is currently in leadership of the organization called Equal Rights Washington, which is an LGBT advocacy organization. Yesterday, I met with someone from King County that is currently looking for providers to apply for an RFP. She has a lot of funding and a lot of people that are willing to, but is looking for small community-based organizations that are specifically looking for, I'm sure I could find it. I think she has emailed it to me and I can just find it. But it's specifically looking for homelessness prevention for specifically LGBT identified youth. So if there are any like organizations or small groups, specifically in King County, that are working with any of that population, she is like actively reaching out to every single person that she can think of and find that might know of organizations that are not as big, and that are looking to increase their funding. I just met with her yesterday and she told me that she has worked with small organizations in the past and has helped them become like multi-million-dollar organizations. So I can drop my ERW email on top of finding this RFP. Or I can at least like drop her email. Would that be helpful? Ashley's counterpart. Sorry, I know Ashley so well and I forget your name. It is right here. That is her email. Yes. Gov. Oops, sorry. .gov. I will fix that so you can copy and paste it. But I gave her lots of suggestions and hoping to follow up with some more for her, but I don't pretend to know everything. And especially this group of people, if they know of any folks or organizations or small groups that are working with small budgets that are looking to increase it, just wanted to share that. That's all.
Thank you, Gerald. And like we said, we're going to be ending early today, just with less going on. So thank you everyone for joining today's meeting. Be sure to look out for the feedback survey. I believe that's the thing that popped up on the screen for some people, but it should send out as well, right, Erin?
Yeah, I'll follow up with that with notes, the recording, and a survey just to give us your quick feedback after the meeting.
Yeah. Thank you everyone for joining.
Thanks, everybody. Bye.
Bye. Thank you.
Thanks so much. Have a good one.
See you all.
All right, Mayana, let me relaunch that poll for you and it'll take you just a moment.
Thank you. I don't know why it didn't show up normally, like it used to. So I don't know. Maybe it's just my phone. There we go. I see it now.
Oh, good. Okay.
And you said the
Sorry.
wrong date is like, that's fine. It won't.
Yes, don't worry
Okay.
about that. I'm sorry. I just needed to update it before the meeting started and I realized after the call that it was there. So cool. I got you. It's all official. We're good.
Okay. Well, thank you guys so much.
Thank you. Take good
Thank
care.
you.
Bye.
Bye.
Bye-bye.
Okay. And Rosemary, here I will stop the recording.